My name is Danielle, and I will be presenting the Psychiatric Assessment Report for Randall Patrick McMurphy. McMurphy is a Caucasian male, single, in his early 30s. His chief complaint is his inability to hold a job or remain out of jail. His present and history of illnesses include antisocial personality behaviors during his childhood and adolescent years, several recent incarcerations, and continued alcohol and drug abuse. His physical development was normal. He has above average intelligence and no formal psychiatric evaluation. His family has no history of psychiatric illnesses, but alcoholism is prevalent throughout his family history. He was not close to either of his parents. McMurphy underwent a routine physical examination, which resulted in normal bill of health. He did test positive for marijuana use. His blood work resulted negative for communicable diseases, and an MRI of the brain showed no significant abnormalities. According to the mental status exam, McMurphy's appearance is hygienic and rather plain, yet it resembles the rebellious image of the 1950s and 60s. His behavior deliberately attracts attention, and he does not like to cooperate with authority. His speech is fluent and coherent. Affect and mood are usually stable, characterized by a nonchalant attitude, but when agitated, he does act out with aggression. His perception abilities all seem to be intact. His level of consciousness is normal, with the ability for insight and judgment. His cognitive abilities are at a high functioning level. He is generally knowledgeable, and he has no suicidal or homicidal ideation. Auxiliary data. Interviews with family and friends were unable to be attained, but we did access reports from former employees and police officers that indicated a history of drug abuse, alcoholism, fighting, and minor criminal behavior, such as stealing. The complete medical history and physical examination reported nothing significant aside from the drug and alcohol abuse. Laboratory tests resulted in no communicable diseases, and the standardized interview that was utilized was the mental status exam. Psychological tests that were administered were the WAISR to measure his intelligence, which resulted in above average. The Myers-Briggs type indicator was reminiscent of a mildly introverted personality, and the person picking an apple from a tree, or PPAT test, showed poor problem-solving abilities. Brain imaging studies were done by MRI. No significant brain abnormalities were shown. McMurphy presents no immediate threat to self or others. Signs of drug and alcohol abuse are prevalent, and in spite of his proneness to fighting and lack of respect for authority, we believe that treatment can be successful. According to the DSM-IV-TR, McMurphy has an Axis I diagnosis of alcohol abuse and nicotine dependence, which is provisional. A V code of malingering feigning mental illness. Axis II is characterized by antisocial personality disorder. Axis III, general medical condition, is none. Axis IV shows occupational problems related to interaction with the legal system and crime. Finally, Axis V, a GAF score of 41 is current. A prognosis. Despite having an early onset and his condition being chronic, McMurphy's antisocial. 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 personality disorder and drug abuse can be treated successfully. a biopsychosocial formulation. Criteria for successful treatment include a therapeutic community, strict rules and consistent immediate punishment for rule breaking, and a positive attitude expressed by both therapist and patient. The treatment plan. Additional data will be gathered by drug tests administered randomly throughout the duration of treatment, as well as after completion. The PPAT will also be administered at the beginning of each month during the weekly art therapy session and at the completion of the program to show increased problem-solving abilities. Treatment goals. Immediate is for McMurphy to be able to function without fighting and with compliance to authority. The short-term goal is for him to remain drug-free and alcohol-free, with the exception of cigarettes, and to be able to work alongside and with others in a productive manner without antisocial behaviors. And the long-term goal is for McMurphy to be able to return to mainstream society and lead a productive life without drug and alcohol abuse and without reincarceration in the criminal system. The treatment plan includes several different therapeutic milieus. McMurphy's McMurphy's treatment plan includes several different therapeutic venues. Start over treatment plan again. McMurphy's treatment plan includes several different therapeutic venues. For instance, he will first be admitted into a therapeutic community where supportive expressive therapy, such as cognitive behavioral therapy, weekly individual counseling sessions, and art therapy will all be provided on a regularly scheduled basis. Several pharmacological treatments, including but not limited to risperidone, bipridine, propranolol, and diazepam, will be administered and regulated as needed, as these drugs have shown to ameliorate symptoms associated with aggression and impulsivity and antisocial personality disorder, as well as symptoms of akathisia. McMurphy will also be allowed to choose to participate in agitation therapy because he does not display excessive manipulation or violence toward others. It has been found that this particular therapy is most effective when a patient freely chooses to participate and is coupled with other forms of therapy, such as the expressive therapy and cognitive behavioral therapy. Upon successful treatment for a duration of at least 9 months, as exhibited by a significant reduction in antisocial behaviors and a drug-free testing, McMurphy will be released to a self-monitored group home program with other individuals who are at similar levels in their treatment of their antisocial personality disorders. This group home will have limited supervision by experienced counselors. It will consist of strict rules for house maintenance, work-seeking, support of others, and absence of antisocial behavior, and this will be enforced by the peers living in the home. It will also be rewarded through a privilege hierarchy. After successful 3-month duration in the group home, McMurphy will be allowed to participate in a wilderness program with others in treatment for antisocial personality disorder. This program will allow individuals an opportunity for a rewarding experience for productive behavior where noncompliance is immediately punished. An example of the wilderness program would be being stranded in the desert and working together for survival. This program is monitored from a safe distance by professional survival guides and clinical professionals. Regardless of McMurphy's decision to participate in the wilderness program, if he has been able to hold a steady job for at least 3 months, he will be released from the group home into society. Social networks will be provided to help him reacclimate to society, including housing, substance abuse programs, and weekly counseling sessions. The first follow-up will be completed 3 months after release, with subsequent follow-ups every 6 months for 1 year, and then once a year afterwards. This completes our treatment plan for Randall Patrick McMurphy. Thank you for your time.